scenarios, and it really does help you have some pieces of the puzzle you might need later, so. Be sure to speak loud. We could go, okay. All right. Well, for those that are following online, just want to welcome you to this part of the meeting. We're getting ready to do our discussion of just things we came across with open enrollment. And I just wanted to start with any kind of feedback from people of what you thought was positive, some positive help that you were able to give, things that were just a good result from the open enrollment. So just share as you want to share.
Very exciting. I thought it was nice to see people again. I've done a lot by phone in previous years.
Yeah,
It was nice to see people again.
that's true. That's true. And just a big turnout, I thought. I hadn't done it kind of the last couple of years, but to me, this seemed like a really busy year. How about everybody else? Did this seem heavier traffic than previous?
I think we had heavier traffic, and a lot of it is people were confused by Advantage Plan. And sometimes they make an appointment and, you know, said they were gonna come in for, that they really wanted to talk Advantage Plans. It wasn't Medicare Part D. So, I mean, I think that kept us busy too, because
Exactly.
you're clarifying stuff for those people, you know,
And I noticed that too. I had probably, I'd say 30–40% more people ask me about that. And just people wanting to come in and talk about that, make sure they understood it right. And so I got a lot of inquiries that way. And I feel like probably part of that came from just the ads on TV. Some of that was confusing, you know, do I have to have this, you know, wanting to know about where they can get the help with the Part D premium, all of that. And I'm glad for those doors, because people need to be informed, or just kind of eliminate the confusion. So I was glad people were inquiring, but I did have a lot. Unfortunately, I don't feel like I know enough on some things with the Advantage plans. I could give them generalities, you know, the general ideas on it, but when they want the specifics, I can't tell you if you have the best plan right now. A lot of it was people that already had them. You know, I can't tell you, because some things it's not real clear on what they pay for, what they don't.
one, if they have Medicaid, you can't help them at all during that.
Right, yeah. So it's just,
Why is that?
Well, I had, because if you look at open enrollment, they may come in and talk to you about drugs, but you can't enroll them during that quarter, October through December.
you can't switch them
You can't, no, you know.
as far as if they want it, as far as you couldn't. What I mean is, like, I had somebody that wanted to, which that is kind of confusing, that last quarter, they can't make changes.
Yeah.
But I think they can enroll in a different one. I think that's it, but they just couldn't, and they couldn't drop. I was trying to think.
Well, I thought it was, the special enrollment's not available because you have to use the annual enrollment. So you
I tried to do that. I tried it, don't do it. I had somebody on Medicaid and Medicare, and so I waited till after December 7th, you know, and I thought, well, you know, and it said you couldn't, but it let me enroll them. And so then the person got all these letters that said, you can't, you're not enrolled with us, you can't do all this, you know. So I mean, So you really can't.
I'm not, yeah,
I
I'm
could
still
not
not,
enroll her during, I had to wait.
really? What I had one time, somebody needed to change, but it was like the first part of October,
Mm.
they wanted to get out of it. And we couldn't do it until January.
To get out of the.
They wanted, what it
DSNP.
is, huh?
Get out of the DSNP.
Or-
Special needs plan.
Or it was just an actual advantage, it probably was one of those. But what it was is, this is the deal. They wanted it to change, like they wanted to, this is the deal, they wanted to drop it in October and have it change in November, it wouldn't do that. They can't change, it won't change until January.
Right, yeah,
That's the issue, you can't change it for the next month. It's gonna switch as of, yeah, that's blocked off those last 3 months, yeah, 'cause she had this was that one that had a broken shoulder. Couldn't get treated in Pittsburgh, had to wait to go to almost Wichita. Find where they could treat her, she had Medicaid, all of that, but the plan did, yeah, yeah, so that's why, yeah. So there's some changes you just can't make, and others, and they won't fall the next month. You know, they won't come in the next month, so, and I had another guy wanting to do that, and I couldn't help him until January, so. And I can send you stuff to clarify that, I know we've kind of been muddy on this, but I can send everybody a note to write that out there so you understand.
Well, I do have that copy, because I did that presentation at, where did we do it last year, Iowa? For the, Aging Expo,
Uh-huh,
and I sent that, did I send you a copy of that presentation?
yeah, I'd have to
That was
find
a
it,
mixer.
it was at Fort Scott.
Oh, but I was gonna say, you could share that with people if you want
Right.
to, because
Right,
I did a comparison of Advantage Plan and regular Medicare.
right,
So
right, yeah.
if you want that information. You can, because if you're like me, I can go to the grocery store and somebody will stop me and ask me questions. So,
Right,
you know.
right, just word spreads that you can help on that, so, yeah.
Mhm.
Any other kind of,
I had this, factory that's been, I don't know, if somebody's been telling them wrong at the factory, but they're like, when they went to retire, they think that's when they have to start on Medicare, and I had someone at 67, and, now they got the penalties, and he like knew 3 or 4 other people up there, because that's what they got told at the factory, that they didn't have to start Medicare until they retired.
Did they have insurance?
He did, yes, so he got out of the penalty.
Yeah, I shouldn't have.
I would say, I think we did have more people that had both Part B and Part B penalties,
This year.
because they were told wrong.
right,
Some of them didn't.
Didn't know, we had a 90-year-old who had never had B or B, and I was like, how do you manage to get to 90 and not have?
right.
And I was like, oh, that penalty's gonna be atrocious.
Well, and I think I had 2 or 3 similar, I even had a doctor that didn't know he was supposed to have Part B. Didn't know, and can you imagine this? Yeah, a doctor, well-known doctor in the community didn't have Part B and had that penalty.
You
And
know,
good income, you can't help them, you know, with
Right.
the low income programs. So.
yeah.
Yes, exactly.
Well, you know, I tried a couple years ago to call HR departments and say, hey, I was kind of making presentation, and I had no interest whatsoever in that, but that might be something you offer again.
Right.
I mean,
Right.
it's been, I've seen it more this year than any other year.
The one factory that you guys were talking about, were you able to contact that HR person?
Yeah, I got you.
Okay.
Because what I had come up as a question a lot too, besides people that have been already in the program and didn't have a B, getting that penalty. I had a lot of people just saying, I've got, once I'm 65, I've got to have my Medicare, even though they were employed. That's going around somehow that you just can't, you'll get penalized if you don't get it when you're 65. I heard that a lot. I don't know why.
Yeah, they think they'll get penalized
And that
if
just,
they don't have their
Yeah.
B.
and so I've had several people say that, and, you know, I don't know who all they're listening to, but that's come around, and Yeah, no, just as long as you have credible insurance through an employer, you're okay, you know, so. So it seems like randomly, just different things start to be, you know, in the grapevine or whatever, and you get
Well,
to
they
hear
listen
those.
to their friends.
Yes, unfortunately.
Or, because I don't know that I had it as much this year as last year. They were saying that when they were gonna be going on Medicare in like April, you know, past that they had to have it before December 7th, and I go, no, we can do it. After.
Right.
Next year you'll have it, but not this year.
One thing too that I ran into, I had some family that was trying to, and this is kind of separate, just signing up for Medicare, but they were trying to, get ready, you know, and after their experience, you know, it was about October, they were trying to get into Social Security. Social Security couldn't get until December. And this was Independence. And, you know, they needed stuff in order by January because my sister's a teacher. Well, their insurance ends, so, you know, they needed to have everything set up for him to go over. And so, Independence is really bad. I get a lot of bad feedback. Independence is very.
I stopped referring people to Independence. I had to have them call the toll-free national number because, they can get them in quicker. And I know myself, I had somebody from Florida who set me up. I mean, you know, when I had to do that. I mean, I stopped referring them to Independence.
But don't they have to go by the date they called? I set up for me, A and B. Had to go back from the date they called and they made an appointment. So they
They'll
just,
get it in order, but it still might be late, right?
Mhm.
They'll get it as they come in, but it's still,
but they, back to the date they called.
if they needed it backdated.
Yeah, no, they told me they would backdate. So, like, he called, what was it? Cause, like, July or something, and then it was like 2 months before he got the appointment for B, whatever, and they backdated it back to the July date.
Is that, they need it in July though?
Yeah.
You need to have B added in. And I understand that, you know, I just wouldn't want it, but my brother-in-law needed it as of January. And so.
But he would have the insurance back then. He would have the card. I mean, he wouldn't have the card until he had the appointment, but the insurance went back till January. Like if,
Well, he got ahead of time. He didn't end up being late. And I understand it going back, but I wouldn't want to hassle that personally.
No.
I
no,
wouldn't want
I'm
that,
true,
so-
but I mean, at
because-
least they have that.
Right, because then you go to appointments, if you have to go to appointments, you getting
I've
that
been telling
coordinated,
you,
I wouldn't want to mess with.
You know, they have that 7-month period. You want to sign up sooner rather than later. Do
Right.
not procrastinate, because, you know, I told them, I said, Social Security is 1 to 2 months out, making the appointments. I
Unless they're on
said, unless
marketplace.
you're already on it for some reason,
Right.
because you took early retirement. I
Right.
said, so you want to, do it sooner rather than later.
Right,
Except when they're on marketplace and they get that help paying for that insurance, they like that better.
right.
Oh, yeah.
It is lesson.
Oh, yeah, because our little gentleman that we signed up for Medicare, yeah, he's like, why do I have to pay this much? I wasn't paying this much. Now, why do I have to?
Yeah.
Do I have to take it? I was like, dude, you have to take it. You can't get out of it.
Right, and so one question back on what you said about calling the 800 number, okay, do they, because like, I thought they'd just push you to Independence anyway.
No, they don't.
No,
No, and that's why I stopped doing it, because
Okay,
you know, the guy over at Independence, he's very good. But he's slammed, and I don't know how many people they have. I think they only have a couple people
yeah,
that do it, and that's why I stopped. Cause I used to always be independent, and I stopped doing it because,
Okay.
you know, people get anxious. They get anxious and you don't want to call them 5 or 6 times to you because, you know, they haven't got in
Right,
to talk
right.
about what they need to talk about.
Well, I had a person on the phone that theirs was another issue, they'd gotten mixed up on their Part D help. And so we tried Independence, they didn't answer, well then Manhattan answered. They pick it
Yeah,
up for
it'll flip
independence.
it to the next one and.
Yeah, and but then they said, I'll give you the direct number for the person working your case in the extension, but they wouldn't handle it. Then before that, she said, well, I called Joplin before and they helped, and I kind of thought, no, Joplin's gonna throw you back. And that's what happened, we called Joplin because it wasn't their area, they threw us back. So I didn't know the 800 would
Yeah, I didn't.
directly deal with you.
Mhm.
Okay, that's good to know.
But so many people just coming in 65, you would think they would be a little more patient maybe with that waiting online on that telephone, but they're not. And they want to speak to a person.
Right, right.
Well, and my brother works for Social Security, and he says they're trying, they really don't want people coming in, and that they're trying to do away with
Appointments,
appointments.
yeah,
People coming into the offices.
yeah.
So when did you do yours offline? When did you create a My Social Security account?
I did.
So is that how you do adding it?
Uh,
Is that how you know about anything you have to follow?
Yeah.
Because we've had good luck helping people set up their My Social Security account that's doing
Yeah, it used to be easier.
No, you haven't, I did that.
You don't think so?
Oh, it used to be way
If
easier.
they don't have an email, I mean, I
Right,
get people that
right.
have emails, they don't have.
Right.
Not doing the system.
And do
Well-
they want you to take a picture of your driver's license?
Front and back.
Okay. 'cause
You can
that's
get around
temporary.
that a little. Some of them still pop up.
It's actually changed, yeah,
Okay,
they've changed it.
but I knew it wasn't what originally I thought it was, and then they were doing that for a while, but I hadn't gone back,
But they have to have a cell phone, so we can get an activation code.
Yeah.
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 And if that doesn't work, then they have to wait for the letter.
Letter to come in,
and
the activation code, yeah.
At least 3 people have to wait on the letter, and then they came back in, and then we got it done.
Right.
And I found out this too, kind of in the middle of my brother-in-law's situation. I guess when you have your My Social Security account and you've applied for your Medicare, it will give your number there on your
Yeah.
account
Yeah, your
before you get
benefits
your
letter will
card.
show it.
Yeah,
Before you.
and so
see it, yeah.
that's great to have if you're in the crunch to get your supplement going and stuff. So I was glad to learn about that. That was good to know.
It's not real evident, you have to go up there and click your benefits letter and then look at the letter and it's in the verbiage of the letter.
Okay.
That's
Okay.
where it's at.
And in your mail or some part of it, messages to you.
But this generates a benefits letter, yeah, that you can print and take
Good.
for like
Wonderful.
Santa, this,
Yeah.
people need benefit letters.
Yeah,
Well, I like the fact that you can actually print out their card now.
Right, you can do that, and then once you get the number, then you
Right.
can make it about the other account and then print
Yeah.
the card and make your.
yes, I knew that, yeah, and that's great too,
Yeah.
yeah.
Well, and I also had a lot of agents praying, and I call it praying, I don't know, but, servicing, these people on Medicaid, rolling them in D-SNPs. So I sent an email to, the SHIP TA. And I asked them about that, and I thought this was an interesting answer, so you can tell me what you think of this. So they said someone with a Medicaid spin down will have to have their Medicaid activated, so meet their spin down in order to enroll in a D-SNP. However, they risk disenrollment if they do not meet their spin down. If someone knows they regularly meet their spin down, they should be able to enroll in a D-SNP. And it may be a good idea for them to make sure they are a few months ahead on meeting their spin down so that their Medicaid remains active and the D-SNP does not disenroll them. On the other hand, if a person does not regularly meet it, will not be able to be in the D-SNP during the month when their spin down is not met. It is therefore not viable for people who do not meet their spin down regularly to enroll in the D-SNP.
Can you
Well, and-
explain the spin down a little bit for some of us that don't know what spin down means?
Yeah, so Title 19 Medicaid, they just protect $475 as a single person, $495 as a married person. And then everything above that, 475 for.
It's the same.
So, okay, and then, so if you make $1,200, the difference times 6 is your 6-month spin down, like a deductible. So with Medicare, basically taking care of 80% of your fees or charges, very difficult to meet a spin down. You have to have a lot of healthcare in a given 6 months. Now, because of Medicaid, not expansion, but continuation due to the pandemic, they weren't dropping people from Medicaid due to spin down. And then also there's that whole QMB population, which really aren't on Medicaid, they're just on Medicare savings. A lot of times they're referred to as a partial dual, they're not a full dual. So they don't have a spin down, but with QMB, they don't get any balance billing, so how would they actually work with a DSNP? So again, and DSNPs are HMOs, and they're supposed to coordinate your care between Medicaid and Medicare. But if you're truly on Medicaid with a spin down, it's not activated if you have a med, so how does it really work? That was my question, how does it really work? And they were saying, well, it doesn't work.
And you know, and the point is, it's 6 months, it's not a year. You
Yeah.
need it every 6 months, so in a year, you
Yeah.
could be on it, like you're saying, you know, and that's just
And
frustrating.
And here in Kansas, you know, we have people retiring now making 1,200, 1,400, where 6 years ago when I started, people retiring making 800, 900. So the wages are going up. This is
Right,
because of
right.
the jobs they had in the 60s, 70s, 80s versus the 50s, 60s, 70s from when I started. So spin down just literally is becoming affordable, so more and more access to benefits.
Well, and I've done this for 50 years, over 50 years. It has not changed one iota, not one.
Well,
dime.
Well, and once you get Medicare, isn't it hard to need to spend down?
Right.
Yeah.
Unless you're a cancer patient or astronomical medical.
And that'd have to be something, 20%, yeah.
I,
When you had $100,000, if you had $1 million bill, 20% is 200,000. And that's, you want to spend that.
yeah,
Who gets $1 million bill? It's just so hard for normal.
I worked at a
Healthcare.
cancer center for a while and there was a lot of people just with Medicare and they would get Medicaid. Because one treatment's $10,000, I mean, you know.
So 20% would be 2,000, and they need a treatment every month.
or
They
even
probably could
every
need
week,
a spin down.
every week,
Yeah.
yeah,
It could be a spin down.
yeah.
But yes, it's very interesting, how these agents,
Yes, and it's really just more confusion and futility and frustration for the people. I
Well,
think.
and I had somebody in my office yesterday who, they talked to him about it, and I told him, well, I told him what his spend down would be. And, oh, well, I'm gonna do that, and I said, yeah, and so you're better off having them pay your Medicare premium, because if you go to a spend down, they're gonna wanna use your Medicare premium to pay to meet the spend down.
Right,
And
right,
you'll be paying it again.
right, yeah,
Oh.
this is like the ELMU person.
Yeah.
yeah, yeah. Now, just to, we kind of touched on it about the marketplace. Just clarify, what's a good time to call if you're going from marketplace to Medicare? Is it
The
a
last
few
day.
days, the last day of the month, enough? That's enough notice.
Yes.
That's the best practice.
Because they changed that.
Because I didn't know if they needed a month out, you know, just because of,
And if there are more people
Backup.
who are staying on the policy, don't do it online, call the marketplace.
Yep.
now say that again,
If
what
there's-
is it?
So like maybe a spouse and some children are still on, gonna stay on marketplace, don't remove that person online, call the marketplace and have them remove the Medicare eligible person. They say that's best practice as well, because the online version could actually take everything out.
Okay, okay,
It has.
okay, and as far as, what about navigators for marketplace? Is there one at every if you have navigators at every CHC?
Well, we're
We have-
CACs.
We're not navigators anymore, and we don't have to be
Are you a
navigators.
Certified application.
Yeah, we're just,
Yeah. But do most of the CHCs help with marketplace? And I pretty much push people that way, because if you do it online, you're bombarded by brokers or whatever.
or they get.
So I've just seen
Or
it,
they go to the wrong website.
yeah, yeah,
That's exactly right.
yes, because I know there's stuff that looks like it,
Yeah.
and you don't, I just push people to go to Thrive or you on that. just
Yeah, Thrive
because-
are navigators. And navigators have an enhanced role, they can do appeals and
Is so,
more so than a CAC.
so, yeah, explain the
They have-
difference.
Yeah, they have to do appeals.
We don't,
We don't.
but we
Okay.
have.
So you are a title, legitimate, it's just not a title.
We don't
It's
do
just-
as much quarterly.
Oh, I'm wrong about
We get to do it every week. I think that's why
Every
we,
week, every month, and every quarter.
we dropped the navigating because, that was.
Yeah, there was a lot of paperwork.
Wow.
reading.
Well, that's enlightening. I just thought it was titles. I didn't know it was specific roles that were mandated by the state. Or
No,
how-
it's by marketplace, by
I get
healthcare.
it, I get it,
The
okay,
ACA.
Navigators are paid through the federal government.
okay,
And if you're a CAC, you don't have, you're not necessarily paid through the federal government, because we've been both navigators and CACs at Thrive. Just depending on what funding they have.
okay, well, that's
2
good. to
years
know.
ago, we got the CMS grant for the federal marketplace, so we do have navigators. And we do have navigators throughout the state of Kansas, that can assist.
Well, that's good info, I didn't know all the logistics on
I
that.
did help.
But we do have a whole lot more for navigators than we did as an assistant.
And you mean like if somebody has an appeal because they were dropped or they
Yeah.
feel like they're eligible and.
Like I did have an appeal, I actually assisted with an appeal, we won't have to, but we can.
Yeah.
And it was very exciting. Just really logged in and I had to swear under oath and I had to, it was very exciting.
I've had,
And they won their appeal.
That's.
I've had 3 appeals and every one of them won.
Oh, cool. Now, can you advise them if this isn't a good appeal? Can you kind of advise them? Maybe it's not the best
you can
idea,
tell them, but
they still, some are stubborn. Yeah. Well, just kind of on that note, I had a guy yesterday I was helping and they were upset because they didn't know what they were doing and they got new Advantage plan, so I helped them get back on D and Medicare and all that, and he said, well, I want to take this to Judge Judy. Just want to ask you, I think I want to have this guy pay for this, and I want to take him to Judge Judy, and I said, no, Judge Judy will see your case. You know, you can complain to Medicare or whatever, but this happens all the time, and.
We had a gentleman,
There's always a first, isn't there? You never know what you're gonna
we
get.
had a gentleman that says, well, who do we need to contact about the false advertisement on the Medicare Advantage commercials? I'm like, false advertisement, no. Pretty sure I can't help you there.
I'm a lawyer.
Come to us and let us fill in the blanks.
Because, darn good well, John Davis is not having Medicare.
Or what's this house things for those? Yeah, who advertises those?
Oh, that,
Thing.
yeah.
Tom Selleck.
Yeah.
These cancers. And he's delivering them a meal.
Exactly.
Oh, we're not gonna have transportation to take him to a doctor.
Right,
Right. So,
for silver sneakers.
oh,
Yeah.
they all want the food card.
Yeah, they don't want that. And make sure you set them up in the right plan. You get the food card.
Right.
So I always ask, what is there in that advertisement that's appealing? Because then you get down to what they really want, so I had somebody who really desperately needed hearing aids. And their agency happened to have money at that time for that, we got her hearing aids, but, because they'll go into this, that you say, well, what about the ad is appealing to you? And you can do that, because sometimes they go on, and that narrows down to what they're really wanting.
Yeah.
Like dentures or hearing aids.
yeah.
What it is.
And it's hard for us not knowing, it says they were gonna let them have so much money in dental. So we don't really know what they're paying for. So they need a bunch of crowns.
Right.
Mhm.
And that's a good point. I had somebody I was talking to, they had an Advantage plan and I think one big pitch this year was that they're gonna allow 2,000 sometimes for dental. Some of them are getting up to 2,000. Well, a couple came in and I was visiting with them and they said, well, it's not 2,000 to one procedure. It's divided among several procedures. So you won't. Yeah, that's your total, so you can't put 2,000 to a crown, you can't put 2,000 to, it's divided up, so that's throwing some people, and, I had another person that they needed a ton of work, and he just said, I already got one thing done and it didn't pay for it, only paid part of it, and, and I call the plan, you know, ask the dentist if they know what's gonna be covered, but I can't tell you.
Maybe before open enrollment again, if we could get somebody to talk about the dental plan, at least when you talk to people going on, you might wanna say, you know, I want you to think about this.
Right.
You know?
And the other thing too, just kind of on thinking about the false advertising. I was on they had I think it was ACL, or it was one meeting, it was the ACL, they had a conference, this was last fall. Were any of you on that or at that? Were you?
I was at a call where a guy from CMS talked about looking at they use acronyms, but those companies that you call on those commercials or TASs or something, TS, and you know, and they get paid, and then they have all those call centers. And looking at how those ads affect their volume and enrollments. So they are looking at it, they do believe it hinges on being misleading. They couldn't say for sure.
Well,
They are looking at it. Was that the same call?
no,
Oh.
this was one where they were just going over Advantage plans. And it was really, I really felt bad for the speaker.
Because people were just bombarding her.
Yes, she was basically girl that her on this, put on the stake and burned.
Oh.
I mean, everybody was flooding, it's, you know, you could chat, it was a Zoom and you put comments, and so she couldn't even keep doing it. Another girl stepped in and said, well, we need to stop for a bit and address these texts that are coming through.
Mhm.
So it was just, and it was about how stuff is not really clear, you know, the misleading and, you know, all that. So it was kind of a very negative Zoom.
We brought that up to the state and asked them, you know, but they said, you know, this is all national advertising.
Right, exactly. Don't pinpoint it to vicinities, you know, so it's a broad, general.
They all do it,
Yeah.
not just one plan.
Right. So, and they mentioned that, the girl mentioned that, you know, we try to get that full scope, and we can't get more of the rural areas in advertising and all of that,
But
so.
as a counselor, it's really hard for us to explain to them what may come up 10 years down the line. You know, they're looking at now, what it's gonna do for them now, not what may happen 10 years down the line when they've given up their other card.
Right, right.
I would bring up the nursing home.
Mhm.
So, you know, if you need rehab and then have to go to the nursing home, you will, that will not be paid for.
And I do the same thing.
I say
I would
that's how we
say,
do it.
they don't say nursing home.
And it's like, you break a hip, not gonna be covered if you need to go to rehab.
I mean, it's
Like,
on the
what?
benefits, but the real world is, we'll only give you one day, you know, not 10 like the doctor requests, right? Because it's in their, they said the same skilled nursing co-pays as regular Medicare does, but yet in real life, anecdotal stories, we find they only want to give one day or.
Right.
2 days.
It's monitored,
What I say.
it's monitored, and then after 2 days, they remonitor.
Right.
Yeah, and I don't know, do you guys know what that little window is when they say they'll let you get out of an Advantage plan if you go into a nursing home? They'll let
Oh,
it
yeah,
stop. Have anybody
Yeah.
been involved with that?
Admission or leaving a nursing home, gives you a special enrollment period.
But that's,
To get out of it.
Yeah,
and back into.
any skilled nursing facility.
But you gotta find a supplement.
Right.
But you can't get a supplement.
Yeah,
Yeah.
because they're all women in my.
Sure.
Now, have you guys had a lot of people seem okay about that trial period? You know, they have the trial periods where you can, you initially start a year and get a guaranteed go to supplement, or vice versa, be on a
I had one
supplement.
that went back to her supplement in her trial period for a year. And she was like paid twice as much in Medicare, or medical expenses than she's ever had. And it was just like the story in there, and so we got her back into the pay plan.
That was good, that was good, yeah. So those are some things I suggest, and if you have good health, you know, I try not to be negative, but and you, and some of you, I'm sure do better, but just kind of this is how it is, and sometimes it's not clear. I remember your example we came up with at the church,
Oh, the church,
where the person was wanting a colonoscopy, and,
oh, right.
and in the fine print, it was only, it
Once
wasn't
every
even
10 years.
right, and she was, yeah, and she was gonna be having it,
Yeah, the doctor wanted to follow up like in 2 years,
yeah,
3 years.
so little things that can, yeah.
I mean, I just know it's managed care and all the free stuff changes how your healthcare is delivered. So you really have to weigh that free stuff versus the healthcare changes.
Yes, and do your homework, and if you don't like insurance, and it confuses you, be sure you have somebody helping you with it, because it might be too confusing.
And that's you.
Right, or their bright daughter, you know, or their family member.
Oh, no, I haven't got a kid yet.
And I was
Yeah,
looking at the.
yeah. Yeah. But you know what, I have seen people that do well on them. I have seen some people that haven't had to pay a lot, and it's worked good for them, I've seen that, so.
No, I had somebody change from his supplement to an advantage plan, and I haven't talked to him yet because he had something the 1st of January to see how that bill went.
And he has 3 months now. He has this little window, just a reminder of that too, people can get out from January to March 31st from their advantage plans, so if they have cold feet or something really scares them.
And real quick, what's the deal with many plans in hospice? If you enter hospice, many plans don't work well with hospice.
I don't know about
They don't work well with
About
anything.
that.
Huh?
They don't work well with anything.
I hadn't heard about that.
So,
Something to check out that way, something to check out.
research.
Had you heard, what had you heard about that?
Well, remember when the agent came and talked to us, and I remember
Yeah.
one of the slides said something about hospice and Medicare Advantage. No, actually, it wasn't when the agent came.
It was
when,
Janet?
Janet came. So,
I'd have to look it up in
I want
our,
to review that.
in our training.
Yeah,
In
we
the
can do
training, yeah. This was something too, just an FYI, Tara and me and Julie in August, we did a presentation at K-State in Parsons. And this was very interesting. I don't, did any of you hear about
that.
it?
No,
Oh, if anything could go wrong, everything.
really.
No, we had no,
No audio, video.
no audio.
Oh, you're kidding.
Yeah, oh, everything went berserk, no mics,
Oh
in
my
a full, huge, one of our biggest meetings, yes. I mean, I was ready to just leave, really leave fast. But what happened was the worst of all, and I've noticed this for kind of with situation. I had a heckler in the audience,
A what?
heckler,
About what?
Advantage plans. We were just telling the general education about it, and she just started. She was
Like
talking the whole
over again.
time against
Oh.
us.
So,
Yes, yes. And she was back and she wouldn't quit talking and just kind of negating everything we were saying.
oh my God.
So, yeah, and finally, you know, I wasn't sure, but I couldn't hear that much, but then later I had some people in the audience I knew, and they said, well, yeah, we could. She just kept,
Going on.
yeah, and they heard the comments, you know. So just beware, something like that might come up in the future, you know, please refrain from talking. And, you know, she was healthy, and had done okay, but you mentioned the nursing home, and mentioned you gotta do your homework, and you never know when your health is gonna deteriorate, and it will be a problem, so. But I thought that was one more thing we, that meeting, for sure. With everything going wrong, yeah. And then something happened on our advertisement too, they thought a couple of them were at 2 different other buildings, so 2 different sets of people showed up at other K-State buildings, so. Just park of the current course, yes.
I have a question about, Medicare A. I was told early on that they should file for Medicare A when they turn 65, even if they were working, because then their other insurance didn't have to do meet B, but their other insurance would be their secondary. Is that not correct?
Depends on the size of the company.
That's part of it, and I just sent a question into Janet the other day on that, because I've wondered, when's it come to deductibles? You know, is A really helpful? And everybody that email, because she basically said, sometimes long story short, A doesn't help that much when you have your other insurance. What do you guys know about that? How does it work when you have the deductibles? Because you have a work deductible. A has a work deductible. Would your work deductible come first? If it's paying first, it's gonna come first, right?
More employees, yeah.
Yeah, so how does A look at that then? See, they're not gonna make you meet their deductible for hospital? That's where I don't,
Well,
I don't get that. That confuses me personally.
well, I think A pays secondary, so if there was a deductible expense that, exceeded the deductible of the A, then A would
Right.
pay.
Right.
I always thought it was just advantageous to add B and D later, or add A. So that was the benefit I always knew, that this, let's just get your Medicare in place.
Right.
A only.
Right.
Keep your job plan, and even if you work at 74, it'll be much easier to add the B than the D.
Well, it doesn't hurt you. It doesn't hurt
Right,
you.
it's free. Regine knows for since you ever told me today. It's free.
Yeah, and I just didn't know how much it paid.
That's what I've been telling people.
Yeah, and
You
it's
need to
not
go ahead and
wrong.
sign up for A, but you don't
It's
have
not.
to for B, so.
Yeah.
I'm running into more people that don't have it. They wait until they retire.
And then sort of pain, and then it's 6
You
months
think it's more of a
retroactive.
pain to wait and do,
For
see,
A,
I'd have a pain of doing adding the B personally. I'd just rather do it together, but it's not gonna hurt to
well,
have.
if you already have your My Social Security account, you have the A.
Yeah, that way would be, yeah.
Fill out those 2 little forms, CMS 40B and
Yeah.
CMS L 564.
But you must be seeing a whole lot more people that have our computer literacy or even has computers.
I said, can I create an email? Thank you. And I create them a Gmail, and they usually do have a cell phone. If they don't have a cell phone, then you're right. They have a hurdle, gotta get over there.
No, but
Yeah.
I'm not meeting those people that have
Email
a
account.
computer, no.
Yeah, and either. I get, what did you say?
I said, each year I get.
Yeah, it's, I had this happen. I had a call, this was all during COVID. A person was panicking, they didn't wanna be in public because of COVID, so they said, I'm gonna get my Medicare going, okay? So they contacted, Social Security, and they went through an agent. They went through an agent. And that agent was gonna help them. And this is what I take, they would have had to have A, they already had A, but they needed to get the B going. That's where everything went to pot. They stuck, the insurance agents was gonna do it, they never got it added. They never got it added, sat in file, they never got added. So 9 months later, he goes into a doctor's office, you don't have B, you don't have B. So I've been paying for a supplement all these months, you know, all that, well, they shouldn't have taken when he had the supplement, they didn't have B added. So another mistake. So anyway, they went to the insurance person, they were trying to give them what they could, and I just said, well, you get, and Social Security was trying to work with them, but they said, you know, we don't have what we need, and I said, well, you show them where you've been paying that supplement. Show that evidence to support what you tried to add it, you know, because I don't know if the insurance person was kind of, well, it was a big mistake on their part. That was
Wasn't
sitting
it like a fault of the system itself, that it wasn't audited itself, that it wasn't paying out, accepting payments for supplement, but not, even though the person wasn't enrolled in.
I don't-
I see that happen before they pay supplement. and
How
did
can
not
that even
pay.
happen?
It's.
Well, it's private insurance, I don't know.
Right,
If you never used it, you
right.
didn't have a reason.
Right, that triggered it when he finally used it. He hadn't used it all that time. So that's why it was just sitting there.
I
And
worked with someone that had, Blue Cross Blue Shield and an Advantage plan.
Yeah.
For
Mhm.
2-3 years.
Well, luckily they didn't shut the Blue Cross down.
Yeah, luckily they didn't because they ended up in the nursing home, so.
Yes,
Going back.
yes.
Rhonda had that.
I had that happen too, like they had 2 or 3, I was like, how do you have? an advantage, 2 or 3 different supplements, I don't get it. And it was all listed on Medicare.gov.
Are you serious? Are
And
you
it all said it's current, and I'm like,
Yeah.
yeah, he had to start the Alzheimer's, and his kids were trying to figure it out. What he had, what he didn't have, what he needed, what he didn't need, and I was like, oh my.
Well, that amazes me too, because you do see the string of cards, you know, and half of them are expired, but they just don't know what's, you know, stuff, so.
Well, that's fine. And she's supposed to this one, right?
Right, yeah.
Kind of, unless they don't know,
Yeah,
and they gotta be doing that as a doctor and everything, but.
yeah,
You know,
Just-
you tell them to hand you the cards and the appointment, you get a handful, I'm like,
yeah,
okay, let's go in here and I'll just see which one of these are current.
yeah.
Yeah.
Just an FYI too, I ran into this yesterday, a guy had an Advantage plan, he had Medicaid, and he had a supplement still. And I told him, and I don't know how many of you realize it, but you can put your supplement on hold. You can put it in suspension for, I think it may be 2 years. They have to work with you if you have Medicaid to hold that, because sometimes people don't know if I'm gonna stay on HCBS or I'm gonna stay here, and they wanna go back. So you can call the insurance. Now, I can send everybody that clip out of our manual, where you can put a suspension and not drop it. And then if you need to go back, you can. And that gives peace of mind to a lot of people, because they don't know how they're gonna even get workers to help them in the home for the Medicaid. There's all different scenarios, you know, or am I gonna like this? You know, we have a lot of people that they aren't good to their workers and the workers never will. You know, I mean, we have irate people that they can't keep a worker, you know?
They don't want
Yeah.
anybody in their.
Right, yeah, so it's not always gonna, and, you know, nursing homes is a little more a done thing, but definitely, yeah, that's an option, good to know about that way, so. Something else I was gonna say, and, I don't know if any of you ran into this. Just, and I think a lot of you are already doing it really well, as much as you can, you get people that MyMedicare.gov account to do all of their stuff through. Okay, and I had people that I was doing stuff in Fort Scott and all around, and some of them did have their accounts, remembered it and brought paperwork, which was wonderful. Now, I had a few problems of saving in MyMedicare.gov, the PDFs that Janet wanted us to save so we could report. I ran into some problems. Did any of you try saving PDFs in MyMedicare.gov?
No.
That either threw me out of it. We'll get on that a little bit later. But it either threw me, it just didn't come together very well. So I stopped saving when I was working through that. The other thing that was a really big glaring sign to me and frustrating, because I have a lot of people that don't want to do those MyMedicare. They don't have email, et cetera, they don't want to do them, you know? And yet I say it's just a one-time thing. You'll use it every open enrollment, and some just still refuse.
Right.
Well, I had a girl that was Medicaid, and she came in and wanted to, you know, get her plan set up for next year. I didn't like what my Medicare was, or what Medicare Gov was showing me. Did you ever have weird stuff on your Medicare Gov? I did.
Like, what was it showing?
Okay, this is what it showed. She had huge expensive medicines, a bunch, huge list. Guess what her best paying plan was? And I had put in she was Medicaid. Guess what?
Oh, this was that account where you go in the
Yes,
blinds.
just-
Okay.
Yes, it showed the $100 plan, her best bet. The United Health $100 premium as her best plan.
But they weren't Medicaid.
So here she should have $30 off. You know, they give you that allowance for your Medicaid, a $30 window of getting that
Oh, we got a
refunded.
standard base plan and,
Yeah. She ended up, was gonna have to pay $70 a month.
Was it because the drugs weren't, all drugs were on the formulary?
No, I couldn't, it wasn't, yeah. So then I asked, because then later she came
Or
in,
maybe that was the only plan where they were all,
possibly,
the
yeah.
5-3 were on the formulary, so it jacked them up.
Yeah.
Yes, that was probably.
Yeah, and so, anyway, you know, That's what it showed. I said, you go talk to your pharmacist. I don't feel good about this. You ask your pharmacist if they can tell you a plan that is best for you. And then I'll come back and apply. I'll enroll you. Have you found that not to work too good either?
I would have used that as an excuse to, we've got to see what your actual spending is, we're gonna create my Medicare account.
Well, and I didn't realize that.
Because once you create your Medicare, it'll say, full extra help,
Yeah.
zero deductible.
Right,
Even though
but
the partial, it still will say partial when it's full sometimes, that's still not fixed completely.
But through my Medicare, I mean, not just regular Medicare.gov, you can put their Medicaid.
Yeah, you can go, I get extra help, or I get Medicaid,
Right.
one or the other.
Right,
But if you wanted to confirm it,
It's easier in there. yeah.
right. And that was the big issue. It wasn't as accurate. It was not accurate in just Medicare.gov. It would have been more accurate in my Medicaid, my Medicare.
I don't give my people that I work with
That
an
option.
option, we gotta do it, my
yeah,
next.
I think that.
Well, I've got to become that way more. You know, it's just you're gonna have to do it.
Well, the only time when you don't do it is when they have maybe 2 or 3 medications. It's not that big a deal, but if you got 20 or 25 medications, I have to put it in there, and that's what I found.
On it back up.
Well, yeah, because it is.
Yeah,
Yeah, I mean,
Yeah, so you can go in and put.
right. It is so much simpler. It is so much simpler now.
Yeah, let's have
Yeah,
it.
the brand new, yeah.
you don't see that many in
Right.
enrollment.
Right. So, you know, most accurate comes
And I
that
make
route.
them a little, I order cards and I make them a card that they can keep in their bill folder. I said, you can use it.
Right.
I give them yellow.
I would say we give them a folder.
So, yeah, just that came up. She came back later once it all started.
Put it with your important.
This is the thing too, here locally, had an issue with the pharmacy. Was in looking at plans and, I noticed when it was on my Medicare that this pharmacy, there was a big gap between what the preferred of Walmart and I think Walgreens were paying and neighboring network. The pharmacy, but there was a drastic difference on what was the coverage. Okay, and I didn't feel real good about that. I didn't know for sure, but we ended up enrolling in the one plan. Well, here, January, people were coming in, the pharmacy's not honoring that plan.
So that
It's
is
not.
one of my biggest complaints. If that pharmacy has not enrolled by open enrollment, they should not be considered
Exactly,
as a,
exactly,
as a,
exactly, because the information isn't correct.
it's not correct.
Yeah, and I think, so then the pharmacy called me and said, well, you can re-enroll, and I said, no. Not unless they're in a special
You have
income
to
group.
apply for that. Call in her Medicare and appeal.
I don't know if they could do that, because I asked Janet about that, because her case.
Well, they always have that. Didn't you say they always have that? They've had for years where if you feel like you've been misled, you can. call
Yeah,
in
you
that.
can.
I thought so,
But
maybe, and I told her the whole scenario, I told her scenario. that-
Was it well here?
Yes.
And she said they couldn't, I said, can they with that? I asked Janet, I said, is that a cost to be able to re-enroll? And she told me no. And I don't know how much I could have spelled it out more for the. So.
I would on that Medicare too.
Just to appeal to them to say, hey.
Right,
This is,
But Medicare should not allow them
I know,
to be
exactly.
listed.
It's the
period.
pharmacy's problem,
Yes.
they're not on ball. It's like he just figured you could re-enroll anybody, no, they're stuck. I thought so, that blew me away too, I thought,
And I have to be very careful because he has a lot of people that he's loving, but he really tries to enroll people in the plans that pay him the best.
yeah, they do.
Not, and I'll just, so I'll say, well, this is not what I hate it, okay, we gotta have the pharmacist do it, and we're gonna bring it back to you, and you do it, well, if you have a plan that the pharmacist recommended, just give it to me and I'll enroll. I mean,
And they don't use, Medicare.gov, they have their own program.
Yes.
Yeah.
Well, I did have the guy in town, the new guy that's in town. That came from Independence and they come down here and
Oh,
they're sitting at Walmart
oh.
on a regular basis. And he asked me, he said, well, will you put it in this other system? And I said, no, we can't. I said, because we have to put it in our system.
Yeah.
That I think it would have been a good thing for him if we would do that, you know. No, we
Yeah.
can't do that.
Well, I run a pharmacy in Columbus, I have people that wanna stay in town. They're not able to drive out of town, they deliver to them, and I certainly understand it. I will call them and ask them what their cash price is. And it's so much less than what comes, like a welfare cost. That they'll just pay out of pocket. We give them the cheapest plan and then they pay out of pocket. It's a lot of work for pharmacy, but if they wanna keep that patient.
Huh, or drug, good RX. Sometimes they can do this.
That's, I heard I seen a seminar where the pharmacies are not supposed to tell the cash price unless they ask for it. So I always tell my people to ask what the cash price is.
Yeah.
Okay,
And then sit on the drugs, because the pharmacy can't just say it because of their contracts. But if they ask, they can say it
okay,
then.
that's
So
good to know.
I always tell them to always ask, cause I have one that pays the minimum drug thing because he can get it cheaper cash. So that's what he does. when
Well,
he-
our pharmacy does ask, I mean, they will offer it.
And that's always great.
Upfront, yeah.
Yeah, that's always
But
great.
I ran into a guy after January, in January, that I didn't work with, had never seen him before. He was paying $71 for a premium that he's not using because it's cheaper cash.
Wow.
And I can't do anything till next year.
So, that'd be a huge cost saving. Anybody have an idea of some of the biggest cost savings you allowed some people? Anybody had something really significant? Sometimes the thousands.
I had thousands,
Yeah, just because of drugs not being covered anymore,
Right.
the plans changing, yeah. Very nice when you can catch that for people, sure. Now give me some feedback, because I went in and the stats that they have online, I don't think they're very accurate with stars. I know not everybody enters, I understand that, it's frustrating and all that. How many do you think you guys at CHC saw? Because you two were the highest, and you were the highest actually, Janine, on the figures. And our records just said about 700, I knew we saw more than 700.
Oh,
I figured we're over 1,000.
Janine was over 200 and I was,
Yeah, and so I know that we still, I'm sure,
But the thing is, they don't want you to enter it if you didn't enroll them.
I know,
And you see those people and you help them in.
right, we can enter the stuff, it's just they won't count what's not got figures with it. And, but just like, I did do that this year. It's very hard, it's tedious, it's a
do all those
hassle,
PDFs.
it's a hassle,
Right.
I don't have time for that. I can barely get it in the way it was.
right, and just to enter the contact, and all that info, and I was going on, I just didn't have a good system, and I probably had 200 I couldn't enter. I went to a nursing home to help, well, they wanted me on their system. While I was helping there, I couldn't put up mine, and because it just worked better to do it that way, and so then I didn't get all that, and it's just not very user-friendly at all. It's not user-friendly at all, and so you wish they could work that out better, because we really need the data going in. They need that up at Topeka. That's a lot of how they determine validity, and stuff, so.
But I didn't enter the contacts if I didn't enroll them, right?
Yeah,
Um,
and I tried to get as much
But
as I
you
could.
did plan comparisons, do you want to enter the contact for that? Or does that too much work now that?
I have decided that I really lucked out the last 2 years when I had somebody else.
You can send it my way and I'll enter what I can. I'll enter it, and that's no problem, we want that in there,
I
It's just-
didn't do the contacts if I didn't enroll. I just.
Yeah.
Well, I think I did. But, yeah, that, doing the October by November 30th, and then doing the November,
Yeah, I was totally, I didn't get any entered till January. That's why I was so behind. Yeah.
I do mine real time, I just add
I know.
3 more minutes to.
Right.
I just do it
Right.
right.
it's not good for me.
But I knew you guys had to do more than what this, I just figured you had to do more than what the stars showed.
Well, and if it said 160 something for me, I mean, there might have been 10 people I saw twice.
Yeah.
You know, like they think, so again.
Right.
You know about Medicare, I entered
Right. Well, and this is what I knew some might be duplicates, but I had counted like all you sent me and then what it showed for you. There, it was off, you know, so just not. And then Janet said we can't do data yet as far as the figures, they're still gonna audit that, so, you know,
Yes.
just kind of a little, yeah, yeah,
It was so simple the way it was before.
yeah.
it. Yeah, I loved it when you just put, you know, old plan 833, new plan 288. And you just said enter a number, that was
Right.
easy, but now the documentation,
Yeah, yeah.
that adds 10 more minutes and I don't have the 10.
Right, exactly.
To do the
Yeah.
skip thing,
Yeah,
what's it called, the ECL sign on?
yeah, yeah,
IntelliTrack?
stars, yeah.
Star, that's right.
Yeah. One thing too, just tell you this scenario that happened. I had a lady, this was here in January, call, well, my pharmacy is now charging me, my doctor upped my prescription and they're making me take 2 pills, 2 different pills. Okay, I'm taking a generic and I'm taking the name brand. And that's okay, but it's not working for me. I can't function, I need 2 of the same pill. And I thought, well, what's going on here? Because they said they can't afford to do 2 of the same pill. They can give her 1 pill at a good cost, but they couldn't do 2 pills for a good cost. Yeah, so I went in and looked and I got to thinking, well, maybe the pharmacy's not in network. And it wasn't. And so that's why they divided it up to make it affordable, and I just told her, you need to go to Walmart where it's in network, you can get both pills. And get it not too expensive, but it just seems like they're crunching. What I've noted, you know, and I think me personally, some of the Medicare, that's kind of hard to understand because of the way they're crunching and finagling to get good costs. Some of it just doesn't seem real clear. I don't know, you guys are geniuses. And you may not see that or felt that, but I know with this induction, Inflation Reduction Act, you know, just different things I think they're trying to do, still get their money, but do honor that. But I don't know all the ins and outs.
Last year, my plan didn't pay a dime on my medication. And I spent less than the deductible ones, you know. But, so my plan this year shows, it shows you, okay, this is, if you get things in here, in this, what do you call it? Tier, yeah, if you get things in this tier,
Yes,
then we will apply the deductible to it. But, you know, that information is really well done. You know, where you know exactly where you're at, and the other one, you know, I have several people say, my money didn't pay a dime towards my medication.
That's because the drug was $3 and the applied for deductible, so
Yeah.
they paid $3.
Yeah.
And it was like,
So we
well,
paid.
thank God your drug's only $5.
Yeah.
yeah.
You know?
Yeah. Another big thing too that came up was I had people, they all did the $2 silver script. But what came up kind of on the backside of that, Social Security wouldn't deduct that. And people, they said Social Security would not take that out.
Oh, okay.
Because it was too small.
Too small.
I had somebody,
So they got their letters, you know, we can't deduct this. We had to change it to be auto pay.
Well-
That's small, you can pay a year, you know, I said, well, just pay a year, you know. I just don't know if they'll reimburse you if something happens before the year's out, you know, and you're not
Right.
on a claim.
Well, I had more. Sure wanted to come out of their social security.
Mm.
Yeah, I mean,
Just a raise.
well, yeah, whatever, but I,
62
but I
cents.
was, kind of surprised. Then I did advise one guy on VA, I couldn't believe, he was like, well, I get my drugs through VA, and he had it figured out, and then let me see what it would be if I do Medicare. And, so he had a cheap drug plan, and he, well, this one's gonna save me $2 a month, like, okay. How do you- it's not really, so we check their. You see everything.
Just kind of an FYI, that's what happens, got a lot of people back on that, and then too, I've had a lot of just complaints, people can't understand silver script. You call and it's hard to understand, I mean, I was with a lot of people
Oh,
calling.
call centers.
Yeah, the people are just, it's a foreign language, and they're just not as
Well, Karen.
articulate in the way they
Was
speak.
it well care called yesterday? Yes, it was well care, yeah. Was far.
Yeah, so just some of the hurdles to get through, some of the hurdles.
And I don't know why Medicare is not allowing the independent pharmacies the same as the chains, because they're in the communities to serve people. And it's really not right.
Yeah, it's kind of becoming a monopoly,
Yeah.
unfortunately, to the big companies.
The big companies are gonna go, well, I guess,
Sad, I feel sorry for the private pharmacy and independent.
and their customers, because we don't have a Walmart, we don't have a Walgreens in Columbus, Kansas, so they don't, they don't drive anymore.
Yeah,
They're stuck
yeah, and they like the delivery, and a lot of these places don't deliver.
and mail out, we used to mail to people, and so.
Yeah. Just some of those frustrations, definite frustrations. How did everybody do with insulin? We'll take a break here in just a second. Any issues on the insulin?
It popped up right away. They told us it wouldn't.
Did you found it showing up?
Yeah.
That might more like $12. Even cheaper than the.
I
35.
noticed, yes, I saw that too. Yeah, I think Silver Script is 12 maybe. Somebody was cheaper, but
What's the silver script?
Different plans.
Part D plan.
It was more challenging if they had more than one insulin.
Oh, yeah.
Yes.
Yeah. That was,
And maybe down the road, they'll get the ones that aren't, like the Trojana.
Trulicity and
Yeah.
well, I think a lot of that is because the change was made so late.
Yeah.
And it's
That's what they said,
gradual.
yeah.
They're implementing it gradual too, so.
And then I envision them, changing the formularies, and the more expensive plans will have the 35s.
Ah,
They'll get the money, I'm just kidding.
Yeah.
But I bet,
Yeah.
they'll, the 280 plan, no
Right.
won't be on the formulary,
right.
so you have to go to a $35.
Yeah.
Sorry, there's talking about a new law that lowers or caps the prices for those who are on Medicare.
Yes, yeah, just for
Just
Medicare.
wanted to-
Yeah,
Abbreviated IRA, and that, Inflation Reduction Act.
yeah, well, and Shingrix. I got my first Shingrix.
Yeah.
So, and, no deductible, so that was.
It's gonna be.
And so I've tried to tell people, if you haven't, I put it over to you, because I didn't want to pay.
Well,
It's like,
It's the state paid. Cause I got it when it was the first one, and the state paid the.
So you're retiree?
They paid it.
well, yeah, I got the first one paid for, but then the Shingrix, when you have.
Yeah.
Got it.
Yeah.
Yeah, but I did.
Yeah.
The thing though, you have to be aware of that, because I had a lady who checked into it, and they told her she had to go either Walmart or Walgreens to get her Shingrix shot.
Really?
That's what they told her. When she called the company, and they said, well, you need to go, well, that she has that favorite pharmacy here, so,
Right.
but that's what they said. And then I picked up my Shingrix, but then you had because my pharmacy doesn't inject. So then I had to make an appointment at the clinic for them to put it in.
Oh, for the actual shot.
Yeah. She said, or you can do it yourself, and I'm like.
No, I don't need to.
But I would decide if I'm taking. But I guess we can do
Yeah.
I took my 2 shots.
A lot of people are happy for
it.
that
Get ours.
single shot to be paid.
Yeah, that's true.
Don't want to mess with that.
Like employee,
Yeah.
you get our meds,
Yeah.
that's one of our
I didn't know that
benefits.
until a couple months ago.
So any other little info to share? Anything come to mind? Okay, well, we'll take like a 10-minute break, and then I'll come back and go over some procedural things, some different things to discuss with this stuff.
Easier.
It's like either.
I think my total.
Yes, I'm just gonna move my chair every time I lay here, right?
You're stupid.
So then
Really? I was sawing logs if
no, I would have been up most of the time.
I got up at 7.
Get free.
And you?
Like.
Funny story. Kathy, Cindy retired as supervisor on this position, and instead of doing anything, they went ahead and did away with the position, even though they had 40 some openings, they didn't ask for any of the others. So I was like, they gave me a package and do, a severance package and all that, so long as well, yeah, because I'm like, all, my own is my, but I think, yeah, that's good. All that good stuff, it's like, it's fine, all of it, but I did not feel it was 51. But it was a blessing, and I was shocked, I was like, what? Yeah, forever, 26 years. Yeah. And so now I will just stay here till the end. You probably like it. I love it better. It is better. It is better. There's not so much nonsense. Drama? Yeah, there's no drama.
Yeah.
Well, I wouldn't say none, but there's not near as much.
I bought the 6 quart, but I don't know if just the 2 of it. I read it. Yeah, I read it. Yeah, I have it. And that's what I said. Yeah. And I was right. Yeah, no soaking. And I tried to get out. Oh, I didn't know you had booze. Did you do it? I had my foot, you like seven. Oh my. Nice little getting with you. Like that. So you put like that on. No, I haven't.
Just gonna put it in.
You're good, you're good.
In the quote.
You okay?
You don't also have. Give it a test.
Just sit down.
I think that's.
Yeah. I went out and fed my mom and dad's dogs last
I
night.
didn't understand.
5 ticks.
Jonathan.
You wanna do it? No. No, I'm good. I worked the bigger.
They don't-
Right.
Oh, okay.
This is a fire.
Oh.
I'm good, I'm good. Yeah. That's what I, well.
I didn't.
Yeah, I'm just sitting here all the time, I feel like I'm. Oh, I went home and started scrubbing. But still, all night long. Oh, yes. It is in my head, I hope. Yeah, all night long was just rough and.
I saw that last night, I thought.
Well,
I have to go look at the quotes.
I ran here.
Mhm.
You know I was gonna get that, didn't you?
I said, somebody will pick it up.
They leave it for one person.
I was hoping it.
Stacy.
Yeah.
Yeah. I was cracking up because, we have some plastic silverware or plasticware. And when it was gone, I said, oh, hey, crap, plasticware, we need to order some more. And she goes, oh, no, we don't do that. And I was like, what? So she said, oh, you know, you can use this and you wash it. I'm like, oh, okay. I'll bring my own plasticware.
At the office.
Do what?
Maybe.
Yeah, should I do it in the kitchen area, you know?
I would, just to not have a lot of noise. It shouldn't be.
What's been like disability hearing today
Oh.
for my client?
Ah,
They don't speak very good English.
well, you may have to repeat. For them.
Well, I went to her trial once
Uh-huh.
because she didn't have a lawyer. And they made her get a lawyer because they wouldn't let me go into the trial with her. So she speaks English, she just don't understand English. So you have to say it like a different way in layman's terms for her.
Mhm.
And they wouldn't let me go in there, so the lawyer made her get a lawyer,
Yeah.
or the judge made her get a lawyer.
They wouldn't allow you to be like an interpreter for her then?
Because I'm not an interpreter.
Oh,
They would eventually.
If
okay.
I was an interpreter, it was like, but no. I couldn't be interpreter in layman terms, and they
Yeah.
let me do that.
You almost need that for some people.
She needs it, cause, I mean, she understands English, she just don't understand what they're talking about.
Yeah.
So.
Mhm.
I did a mistake one time, I said that she wanted her stuff, like, and stuff like that in Spanish.
Oh, yeah.
So she got the letter, well, you know, she don't understand the letter, and I can't.
Oh, she's in Spanish, why don't you bring it to me?
Are you working there?
He wasn't working there, Deb. When he got the letter, he was like, how am I gonna interpret this? Oh,
Yeah, I have a hard with all the technicality. Imagine.
Which I knew what the letter meant, so I had to go look at another client, at a full, their file, looking for the letter of another client to be able to go out to Spanish client. It was.
How
many languages do you have?
Just what?
Does it?
Well, a little bit of French, but not like very good.
I was gonna say two's pretty cool. That's pretty impressive.
That's all I want to manage, and. Oh, my God.
It's German and English, you don't understand.
I had someone that I worked with long, when I first started, that was, bilingual, sort of bilingual, but they told me in no certain, uncertain terms they spoke Spanish, not Mexican.
People say that. It's the same thing. You just have the accent and you just have the lingo. It's the same as if you have somebody from. You speak their own language. I mean, it's English, but you know, it's the same with Australians and the British. That's how I equate, you know, I say it's the same thing basically with minor changes.
He was from Colombia and she was from, I can't remember what country she was from, Bolivia, I believe. And they spoke.
They can be a little uppity sometimes. I don't know.
You can't.
Like the Latin people, the Hispanics, it's just such a wide, swath of people with different cultures and such. So they will say, no, I speak Spanish. They don't. They don't speak Spanish. The only ones that don't speak Spanish in the Hispanic world or the Latin American world are the Brazilians, which is Portuguese, parts of Paraguay, they speak their own native language, I can't remember right now, Guarani or something like that. And then, the Guineas, they speak Dutch and they speak Dutch and they speak English. So every other person that comes in from Central America, oh, no, I speak Spanish, but my next door neighbor doesn't. With a little grain of salt.
Well,
It's a little.
this is my
bright.
deal. I've always wondered, okay, when is it Hispanic, when is it Latino? I looked it up on Google, I still couldn't
It's the
understand it.
same thing.
I didn't know when you call it what, you know?
I didn't know there was like 2 or 3 different types.
It's not, it's just,
I
I guess they should know.
It's just like when
But you're making it sound like Hispanic and Latino is the same, sort of, I guess.
The lingo will change a little bit, but then you can just Google it. Nowadays, you can just Google it.
Yeah.
Like the street language, you go like, the street language from Mexico, the street language from Peru, or whatever.
But
Street language,
depends on where you're at.
Exactly,
Different
exactly.
winter.
Right, every region has its
when I
changes.
first went to live in California, I was completely lost. These guys were, they spoke Californian.
Yeah.
Nothing, you know? So I had to
Well-
learn all the lingo that. And then you come here and it's more like regular English, thank goodness. But in
Yeah,
California, it's hard. And then, so many different cultures there, so many,
Okay.
and
And then,
they have their own language in California.
but even in the east or the south.
Yeah, that's what I was thinking.
Yeah, they
I have.
especially the south, they speak a lot of same words, but different.
I would say English.
we have a Creole.
Or the.
Yeah.
English is something else, the beach lingo, whatever, the beach bum lingo, whatever, it would be, I'm like, what?
Well,
I
and
didn't
you know,
understand half of what they were saying, it was
Yeah.
so hard for me.
I took sign language in college and, wanted to learn sign language because it's being used and everything. And it's different for regions. What you might use to be Dallas Cowboys is different. They use a different symbol and, so it's all regional and each has their different signs for their areas, so.
I would say that's more that people than.
Yeah, and you gotta use it or you lose it.
Yeah.
Obviously, I lost it. They said you needed deaf for.
I had a couple of years of high school Spanish, but
Yeah.
this Tony would come in the drugstore and every time he'd come in, he would give us a Spanish.
Yeah.
But you forget, and it's like,
Right, I think I only remember a couple of signs and that's it.
yeah.
So, but, always very interesting.
That's an
anyway.
incredible skill.
Yeah, well, some are really gifted doing it. Yeah. Okay, well, we'll get back on some just different points I wanted to cover with you. First of all, we kind of mentioned about the people signing up for the My Medicare. And it sounds like some of you have forms to give them. Lucille, you mentioned a form. This is what when I got to Fort Scott, now I'm losing her name. The KU worker up at Fort Scott. Joy. Yeah, she gave these to her people, and she gave them an actual little, little folder to keep them in. And keep their drug information she'd given them, you know, like their new plan and all that. I thought that was a really great idea. And this has their username and their password at the bottom, and that was just part of that packet. So I just thought if anybody's interested in these, I can give them to you.
Yes.
And you can make copies from it. And a lot of people that was helping them keep it together. And, I'll just give you some.
We don't have good ones, but we have.
Something like that. Anybody else interested? But I thought I'd try to, you know, and if you guys want packets, we can help you with those. We'll make it available that you can get. Little folders for to keep their stuff in, but I thought that was good.
Anybody who wants to open this account, he has to.
And,
sign it on there.
Have that available. And I can also scan it and send it to you too, but I wanted to give you stuff today. Also, I wanted you to know, if anybody wants these again, I can send them out, if that's useful. Some of you, I think you have your own counseling forms for putting the info on, et cetera, et cetera. But just to make a note, and then this is the MSP program guidelines, infos in the Part B, that 2 extra help. This will take effect, changes will be as of May. They always start as of May. They mention them in the first part of the year, but they don't take effect till May.
Oh.
So I will send out an updated one. Is it April for May? But it's that.
Yeah, because the new number is 1215 in the upper left.
What's that?
1215.
They released the information and it's on with the new year, but then.
It doesn't go into effect till later.
Still April.
I thought Janet told me May. Last year. So
I
that's-
think it comes out in April,
It doesn't
and
go,
they worked
Supposed to be.
in
Yeah.
April, but
not,
it
Or
used
change
to always
effective
be
May.
May.
Yeah.
used to be always May. Okay, and I will update this when that changes.
Oh, that's at the very.
This isn't the new, this is the old, yeah, I will
Does it say like 1139?
33, yeah.
So the one that was just sent out to us does not.
When did you get one? I
They're on the KDA's website.
Yeah.
I mean, it was there and I printed it, and
Yeah.
so, I mean, it's after the first of the year.
Yeah, it always comes, the figures come out, but it doesn't go into effect till,
Okay, but they are correct.
Yes,
The figures are
it's-
correct on that,
yeah.
okay.
and yeah, so just an FYI on that. That part of it, and if you want any more of that sent, but I would send a new one of these with the changes, and that's also on here too. The resource cards are on these things too, so just be making updates and send those if you use those. The other thing is, I have a bunch of these, they're Medicare supplement shopper guides.
Oh, yes.
Okay, and they're from, Kansas Department, yeah, they're not current,
Oh, they're not.
but you could put in some new figures. I just like the graphs in. I
Just for
think that-
references,
Huh?
for reference?
Yeah, I like the little charts.
You have like a whole.
I have a whole big- So if you want any,
No, I don't want any, because I like listening.
yeah, I haven't been issued any of
Well,
those, but
the state is not going to be issuing anymore like that.
yeah,
They're
just-
doing it.
I've never
You'll have
had
to
it.
go online.
That's what I do.
But what I use is little charts. I think the charts are good for just initiating,
What, who pays what?
yeah, A and B, and then your supplements layout, and then also, it's got the,
I am very looking for that.
it's,
Yeah,
yeah, So-
yeah.
yeah, I just like to go there.
If you're talking about, if you're talking about, well, because I always say, okay, do you travel out of state? Different things like that, then it's real easy to tell them, hey,
Yeah.
and you can show.
What, this shows what Medicare will cover. And this shows the plans that, how they respond or work with that. So, And then
Always tell
here,
them something, nay, it's not part of it.
Exactly.
Something that's not part of
exactly, they get all, and
That's-
D, they get all this mixed up with A, B, and D, yeah. And then just shows your way to go Medicare Advantage or go regular Medicare, so.
I do have a question that I've been running across a lot, because I'll ask people, talking about their Medicare.
Uh-huh.
Do you have an Advantage plan, or do you have the original A and B? Oh, we've got the card that says A and B, and I'm like, okay, but do you have additional cards? Do you have an Advantage plan?
Right.
Well, they'll send me it, they have their A and B card, they also have an Advantage plan, but they swear they don't have an Advantage plan, even though the card says Medicaid,
Yeah.
Medicare Advantage plan. So it's just like, dang it, so white it out, change everything around.
Yeah, and they, they're not supposed to use their Medicare card, but they aren't supposed to get rid of it either.
Right, right.
People are calling to get rid of it.
Oh.
I've had
Really?
people tell them that. And they told me that, and I'm like, never get rid of it.
Yeah, and that's just another point, people don't know what they have. There's a lot of that out there. People are confused, and they don't know,
And they have no idea that they have that.
yeah. But they think it's just a drug, I've had them, oh, this is my drugs.
Because it has RX
Yeah.
in the corner of it.
Right,
Up here, it
exactly.
says.
Yeah, so, but I think you decide you want some of these, I can get you some today. Et cetera on that. Another thing, Kathy had met with me and was visiting with me. And she really wants us when we meet with people, she wants us to promote SEKAAA.
Melanie, that's good for you.
Oh, okay.
What's that voice there?
Or just our services, give them a,
I would like to know what some services are.
okay,
And-
well, I can give you our sheets. that show
So yeah,
what we do.
she can promote them.
Claudia voice, hi, I'm Kathy Brennan. I was like, Melanie, when you're out, make sure you're promoting the other services we provide, not just SHIP, because sometimes, no offense to you guys, but you promote your organization better than we do. And so I'm not asking you guys to promote us, I'm asking,
Right, with the volunteers that aren't with
well,
our
they-
agency.
if you know they have needs and we can support them, I mean, we definitely want you guys to make the referrals to access the service. So that, yes, and you guys need to know what we do, you kind of have a little bit of an idea. But, yeah, the in-home care, the support groups, the respite services, definitely, if you get a trigger, that those are things they need, we definitely want to do that.
Not to compete or to compete, but just an awareness, we just want people to realize other parts of our agency.
Well, we can send people to you, right?
Yeah, that's all good to know, all good to know.
Well, also, Melanie, people are volunteers, I mean, the Community Health Center Southeast Kansas is a benefits enrollment center. From the National Council on Aging, so if you do have somebody who wants to apply for extra help for Medicare savings, we can help them with this application.
Yes. Well, and I do promote CHC a lot, I mean, I do direct people a lot, and definitely as far as, and maybe, I always let them know about health prescriptions and stuff.
Yeah,
That,
we have,
that we have that available.
Is there an age that you guys start helping people? Cause I know you're.
60.
60, okay, cause I didn't know that, that was like.
Yeah, I mean, we work with disabled.
Right.
But
For
Medicare, yeah, and
Medicaid.
Nice, yeah.
but,
But there's a lot of times people call and they say, well, I'm disabled. Well, are you sick? Because they think because they're disabled, we can provide services to them. And not unless they're 60.
I knew there was a magic number, but I didn't know
Yeah.
what it was.
Yeah. So just something that way, and also, we will be adding the SNP grant. We will start doing the SNP grant this year, so I will get more details on that, not that it's really gonna be overly involved, but that we will just be helping people regarding fraud and directing them anywhere there might be Medicare issues of them being billed wrong or all of this. We talk the details that way, just to be able to inform in a good way of that, as well as direct people. I know a lot of people don't know where to go. They get issues, but they don't know where to go, who to call, whatever. So we will be taking that back, starting that, and I'll get more details on that to you. What that entails for that. It'll involve on the, any data entry, we can put in that we did that. And I know Janet was trying to tell us even at training how to incorporate that some of the data you do that way. And also kind of how we mentioned earlier, just about data entered in stars. Please send anything. I don't mind entering it, or I can, get it entered just so we can have more figures out there of what the people we are meeting, what programs we are helping. It just can't hurt us when they go to do reports and figure out, our status on everything. The more info we have, the better. And then one of my last questions is just any ideas you might have about recruiting volunteers. You need to get more. We need to, just have better representation in other areas. I had a person over by Wilson County and Woodson County, and they fell through the cracks. They didn't want to keep doing it. So it's just really hard. I mean, we're going to try some new ideas going to colleges, as well as just seeing if people that do taxes, and helping people that way too. Just certain pockets of places of the people.
Hooked on D. If all they'll do is D, and then, that's kind of a natural progression if they want to learn more. I think you gotta get them hooked on D. And, it is, I think the way they have it now for you helping with Medicare, it's more and more involved.
No,
Online, because I had one lady who had 2 medications that none of the plans would cover. And so then, but it really didn't reflect, so then I just took them off so that I can compare. So we had like comparisons, and it's just, the more you play with it, the more you learn how to do that. But it's not, I don't really think it's something a lot of people are gonna come in and say, oh yeah, I wanna be doing that. Because it's hard. You gotta know a lot, and you gotta know about the drugs, and then sometimes you ask, okay, are you taking the generic, or you take, and sometimes the person doesn't even know. And that's why using the Medicare.gov is good, because then you could go in and look at what they're taking.
If you still take a minute, if you still take a minute.
yeah, that's right. It shows even what they just picked up at the pharmacy lately.
Yeah.
Picked from there. Yeah.
But, it's tough, and you gotta make sure you got every medication they're taking.
Right. Well, and just even the test, and Medicare is so complicated. It's, it's just not easy grasping how Medicare works right off the bat. It's involved.
And I've had a couple people say, I was a smart person, and this makes absolutely no sense to me.
Right.
It's so hard to make a decision.
Yeah, and I've dealt with people that are smart, and it's hard. They just can't, figure it out. Yeah.
I get a lot of that.
Especially like I said, the doctor that didn't know he needed D. So.
That was even possible.
That doesn't surprise me, really, because they don't have a clue what they're telling them.
Yeah.
They don't have any idea how much the meds cost. Or how
They
much,
don't.
Yeah, they're not into the business side of it. they're just into the doctor inside of it, yeah.
Well, and my doctor told me, because went and got eardrops and, you know, a little tiny bottle was $100. You know, and he said, you know, if you go to do that, you need to call us back, because he said, sometimes it may have a little bit of something in there that made it $100. Where there can be another thing where, you know, half that.
Right,
Yeah.
yeah.
Yeah. Yeah, I didn't know, but she said, you know, because they don't know the components of the medication necessarily. And it probably something else would work just as well as this $100 medication. Mhm.
And you should always ask for samples for anything
Exactly,
expensive.
exactly.
They're not giving out exams. Samples as much as they used to.
Yeah.
And getting drug rec lunches.
Well, and you can still do needy meds for some people, you know, so if there's medications, they can get that way.
Well, and that's where I send people to CHC to have somebody help them
Yeah.
figure out drug companies and stuff.
Yeah.
Somebody work with them that, I don't get enough exposure to that, but I don't know that I can do it best. You guys still do that, don't you? The people help.
Yeah, we do direct manufacturer prescription assistance.
There's all kinds of ways. That's why it's really hard for us, because if they're one of our patients anyway, and they use our pharmacy, for us to tell them what they're gonna pay, because it's not real. It's not the way we do it, and so it looks like they're gonna pay more when they probably aren't.
Yeah, and I always have them go talk to you about it, to your guys' pharmacy before this is what it shows what it's gonna pay there, but I know that's not it.
Right?
Right.
So what's on
That's
the
just the retail
system?
cost.
Yeah, what's on it?
That's because a
Isn't
non-patient
necessary.
gets that price, or the patient they get a lower price.
But do you
Your
deal
direct
with
care.
non-patients?
You
Yeah.
do now.
You do? Explain that.
Not at all the pharmacies, just
Yeah, but Bignell South
staff and
and.
one other one.
Unless they,
Yeah,
unless they have
you were
apothecary.
part of the drug.
Serious, okay?
Unless I know a lot of people use apothecary. that
And
don't
where
have
is it
the-
happening and where?
Well, I know it's, we have a clinic south in
There's two
Pittsburgh.
there's two clinics in Pittsburgh.
Yeah, it's like that.
And where's the South Bend located?
Right across from Via Christi Ascension.
Oh, there by the hospital.
Mhm.
Yeah, okay.
It's, something south Browns. Yeah. Yeah, next to them.
Most people know where Pin Mines is.
And then where else is it? Then someplace up north?
Yeah. It's either Columbus or,
Okay. And then how's the CHC in Fort Scott coming?
but they're still working on the building. Yeah, we're saying spring now, so what's spring, March 21st? Yeah. Still in the whole hospital working on
Well, that's an improvement. And I noticed, are you guys in Oklahoma now?
it. Yeah, we have a clinic in Atlanta, yeah,
Yeah, so it just keeps growing,
that's right.
keeps growing.
CHC, okay. It changed the name.
Well, that works. That
And
works.
Oklahoma has
Letter
that
works.
expansion, see, so they've got so many more
Yeah.
tools to help people.
Yes.
And I wish they would expand that.
We'll see how it plays out.
It was a voted referendum. We don't have that.
And it was.
Yeah. I don't know how many, you guys would hear it a lot, and Paula, oh, Missouri's so much better. It's so much better. Why don't you have this and that and that, and I wanna, and I don't mean to be mean, but I said, well, then move back.
Yeah.
Like it so much, you know, I don't mind that, I don't say that, but they just so hate Kansas and.
Yeah.
Then mass.
Even
As far as Medicaid,
California and
yeah.
Texas, some of the same thing.
Yeah, Arizona,
Well-
I had it the next day.
And people think they can just come from one state to another
And get the same thing.
Yes,
Exactly.
figure right up.
and the money's equitable and yeah.
And somebody was telling me how they got it really quick in Colorado. Really, really fast in Colorado.
I do like to get water when I was there earlier. Oh, would you let me do that, because I'm gonna get water.
Oh, okay.
We'll
All right.
let you
We'll
sit
be
in.
through here in just a minute.
I
Anybody
was
else have any kind of, suggestions or anything? Sorry about that. You need me to do different, anything you feel like you need me to do to help you along the way or inform you or help you?
So everybody got the message this year, add a medical representative, right? The brand of Medicare account, if you click on their messages, everybody got the message that add or change your Medicare.
Yeah. That was it.
And, I did notice,
Thank
you can't put a period in at my request. Period in. And, yes, I think I had 160 people that added somebody as a medical representative, so when Medicare can talk about them, we'll say if they were in the hospital.
Yes, that's good.
Well, I thought that was good
Good
to add.
backup.
Yeah.
Yeah, we only had one person, literally, that already had to be in there.
Oh, cool.
Then I had one person that added 4 people.
Oh, my gosh.
Yeah.
Did it take-
Wow.
But all our kids. Most people just added,
Yeah.
and then I did have a person that wanted me to be it. So I don't know if I can do that, and then, but I did see the list, it does say you should take. Of all the different people,
Huh.
so, have you heard, I mean, can we be? that or-
I wouldn't.
Well,
I
I
don't
don't know. We're gonna live this through now.
Right, that's right.
Oh,
Yeah,
I'm gonna therapist.
yeah, in a way, we are, I totally agree, like I've had people call me that.
Medical records that I was.
Well, at the same time, it's like, I mean, nobody calm your fears a lot of times.
There you go.
Settle you down if you're anxious, you know, for sure that, yeah. I wanted to make sure everybody's on the listserv. You get emails from Janet, everybody's on that, because sometimes,
I don't think I do.
okay, so I'll.
You might, probably because she didn't change my.
Email.
Oh, they didn't come here?
And then also, and it always comes in a different file, mine don't come in my, regular email, it's on the, I don't know, mine's
Or
divided.
something.
Yeah. Yeah, I haven't been getting.
Okay,
And I don't get a lot of them, but.
right,
I did get.
right. And also kind of back on the thing with volunteers, anybody you think might be a good candidate, please just recommend them. And this is what I thought too, I think a lot of people that have worked like with DCF or done some of those Medicaid things for the state, I think once they retire, or I think they would be good people, or even Social Security. They would be good to, if they wanted to still stay in it a little bit, Janine, you might know people that route that might be interested. Huh?
I know.
I tried to recruit one that didn't work from down my way.
I mean, this is a little easier because you could say your schedule, but somebody wanted, if they wanted to do it.
day.
If I have to be here Tuesdays and Thursdays, that.
Right.
So,
And the thing is too, just like you made the point, I really am trying to go to younger people that are comfortable with computer
Yeah,
and just stuff like that. I know when I actually took my testing for the shift, did the in-person one, I was at Lawrence, well, they were signing up everybody that was pharmacy. It was actually KU pharmacy building was where I was doing the testing, and everybody in the room was pharmacy students. I thought, well, that's a good deal, that they get the info on it, about it. Yeah, it was a whole room full of them. But around here, you don't have that kind of a group. But,
do you guys have an active, like, Kiwanis or Rotary here? I mean, like, do a presentation,
sure, yeah,
because even if you got 1 or 2.
right, and check this colleges too.
Well, I know.
What'd you say?
I said, there are people that come to us.
Yeah, that's right.
Just to always know a different avenue to try. Right.
Yeah.
Now, you said you need more in Pittsburgh, you're kind
I
of
think
short.
so, yeah.
Now, are you able to use Tara much, or that way, I know she stays busy. Yeah, I think Julie might be over there a little
Now,
bit too.
Tara, to
Yeah, she's got a different job.
do,
Yeah.
she moved no, she went to Fredonia, but she's actually in this district, and.
Did you take over
Well, no,
Joyce? Did you take over Joyce?
She's in Southwind now, instead of Wildcat,
Really? When did that happen?
just recently.
Everything.
So she's over.
They're
different
gonna feed it in
counties.
the paper, yeah.
Oh, really? Okay. And I don't know if they filled Joy's spot yet or not. I know it's a long,
Well, she may have been her spot,
that she took that over.
I don't know exactly,
I'll have to check with her.
but that could be hers, that
Yeah.
could have been Joy's.
Yeah.
But I know Wildcat is hiring another person. Besides Tara. So.
Just one of those things you always need more.
Yeah.
And did you guys feel like, I know you felt busy during open enrollment? Fairly busy, was it just really saw the need for more people, probably?
I didn't
Or
feel
was
like,
it manageable?
I didn't feel like I saw as many people as I had in the past, and I wondered if it was because they had gone to Advantage plans.
Yeah.
I mean, some of the same people that I've seen year after year after year, and I didn't, they didn't call this year, and I was
Right.
wondering if they'd gone to Advantage plans.
Right, yeah.
I have several thoughts. What are they?
They kind of the regulars.
Yeah. Yeah.
Yeah.
Speaking of that, well, actually, not, Medicare simply notices, if you are living, should you keep it forever or just the last year?
I don't,
What-
I
any thoughts on
don't,
that?
I don't keep mine forever.
Just
I
after the
mean,
insurance is clear and your EOBs and your supplement, and then,
I mean, you can go online and.
Yeah, right.
get it.
You have you have the,
Right.
yeah,
You know, so, I mean, I keep anything that has to do, well, that's not Medicare summary notice. I keep all my social security that has to do with
Oh.
changes of income and stuff like that. The Medicare summary notices, I do look at them just to see how they charge and if they got paid, but
right, yeah.
I don't know why you need them more than 5 years at the most.
Oh, 5, I was thinking.
Why would you keep them at all?
1 year.
Why do you need to keep them at all?
Well, they-
Well,
To make up
You gotta-
sometimes I've gotten billed for more than one thing. And depending on when it hit the billing.
like a few years back.
Because, yeah, I mean, I had some, they made a year in billing, then they billed it again, and so, I mean, if you're just.
Billing, like Allen County
Yes.
Hospital. I was in the hospital in November and I have yet to get a bill from them. So I know they're late billing.
But once
Yeah.
somebody gets away with it,
What?
then shred them immediately.
Yeah.
Mhm.
Especially
Well,
when you can't even get them.
Yeah.
What do you guys know? I always heard Medicare had 2 years.
Yeah.
Nobody-
Well, I have a bill that.
Sorry.
If you wanna get you some stuff.
I don't wanna do that before with therapy.
Okay,
But,
okay,
if
definitely
there's
come back.
anything left over, I'll.
Okay, okay.
Good to see you guys.
I have a bill like.
Does not matter.
And when I called social security about it, they had archived it, so they would have to archive it back out. And it would be over a week. So I had to, but they didn't tell me exactly when it would be back.
Oh,
So I just called Blue Cross and Blue Shield and they took care of it.
yeah, that's crazy. Wow.
I guess that's the reason why we keep any of this stuff is just in case when they're, you know, so we don't get a bill.
Right.
Well, yeah, well, cause my husband was on Medicare and, they billed the wrong entity is what they did. And, you know, and so I was watching, and so I contacted the entity and said, no, that was the wrong place to bill.
Wrong area.
You know, you need to do here, so, yeah, I don't wanna end up paying it again.
Right, exactly.
Or I don't wanna end up paying it all if it should have been covered someplace else.
Well, the last bill I got from via Christie when I went to the doctor, they sent me a bill and said Blue Cross had United. Well, I had gone to the Plan G from the L
Oh,
this year and last year, because I hardly ever go to the doctor. Yeah,
yay.
So-
That's a good. place.
so my husband did not do that, but anyway, when I called them, they didn't say anything about Medicare being billed, or any, you know, it said Blue Cross and United, so I called them. Well, no, we only sent that because Medicare hadn't paid yet, but that's not what you're gonna owe, and I said, so now why did you waste the paper? Send it.
Why are you giving me a heart attack?
So anyway,
Well,
Okay.
any more questions, anything?
I have a question. I had somebody call that, her husband is gonna be new to Medicare. They're both working, they both have their, insurance through their work. And they've been using both insurance policies at their doctors and whatever. And her husband was retiring, and she was wondering whether he should keep his insurance, whether she should keep her insurance. So I told her that more than likely his was being paid for by the company. So she was gonna maybe keep his on for this, you know, her, and then he was gonna use his as a supplement. But I didn't think they could bill more than one insurance company.
I think that'd be a question for HR. You know, if I'm hearing it right. So each of them have a separate policy, but she was gonna go on
They
there,
work at different companies,
Uh-huh.
yes.
and she was gonna go on to
He's gonna go on to Medicare,
and keep his insurance.
only so she could use it, because his pays better than hers.
So like
Well,
they
and
both
my
have the
thing
same
too
plan?
is,
Is he allowed to keep it if he's
Yeah,
retired?
right, that's the thing,
Well,
Yeah.
that's what I said, I don't know whether.
right, sometimes I always say, make sure your company will let you use it as a supplement.
We have
I
some
always
in here.
check that
That
first.
will.
Yeah, but come on, she was gonna try to keep both, because
Hers and his, oh, I don't know about that. Her having hers and his, no,
well,
yeah,
they've been using both of their policies, she told me, at their medical people, because, you know, they got their stuff paid better. And I didn't think you were allowed to do that, I thought that was illegal.
so they're both on each other's policy.
Yes. Mhm.
Alright.
So, yeah, so, yeah, that's just.
that's that, I would check with the actual agent.
Maybe,
Or
maybe
HR.
it's free.
Oh, that's true.
I would go first to the company.
Yeah, you
But
want
most-
to-
But most of them, even if
Because this
they had a spouse or a family member, it might be free for the employee, but you're paying for that
Right,
family
for the
member
other
or spouse.
and that's what I told her to check to see how much it was gonna cost for her on his plan, if he was allowed to keep it.
And sometimes the spouse can go on Cobra, but,
And what is that?
Yeah.
but
Yeah, but then
not
what
with,
is the cost of the code?
right, it's steep. But they would put her on that instead of his plan. Like I've had people, you know, their husband and wife are on it and the wife has to go on Cobra.
Yeah, but she has her own plan, so that they need to go
Right.
on Cobra.
Right.
So I just
Yeah.
didn't know whether anybody knew whether, a doctor's office would bill two different insurance companies. I didn't think they used to, but.
I never ran into this. Very complicated. I just know when people have Medicaid, you know, if the parent, one parent had coverage, they'd let it, they'd add that in too. And if you had Medicaid, but if the father had coverage, they could add that, and you see that at times, where they, yeah. So maybe somebody doesn't have to pay, I'm sure they don't want to. There's a way out of it.
Insurance companies are like
Yeah, yeah.
Well, I mean, just like Medicare, and I would say, was this as a result of workman's comp, you know, that's the thing you got.
Right.
You know, and sometimes long after the fact.
Well,
Well, and speaking of workers' comp, I'm gonna give you a little on your Medicare account, so. I had a patient who had workman comp as a payee still on their Medicare. But from like the nineties, I was still showing up as a workman's comp claim. So we went to Medicare.gov and actually found a letter from like 2012 or 2014. And I was able to print that. The lawyer has since passed away. And they sent a letter to the firm. Oh no, we sent it to Medicare explaining this has been closed and this, and they finally did close it off there and take the workman's comp off, so Medicare could pay this bill.
wow.
So that stuff
And
somehow is archived in there. Yeah,
you actually found a letter in the Medicare.gov?
yeah, and evidently he was supposed to have signed it and returned it. Of course, he wasn't able to, or he didn't remember anything about it according to her. This is the South.
Yeah.
But we explained the situation in the letter and she signed it and mailed it to Medicare. Eventually did remove it. No, hadn't passed.
She got the letter like 2 years later,
Oh, well.
I've seen a delay of stuff crossing over into Medicare. You know, especially with making changes on D and stuff. I've seen stuff not show up yet, and I just ran into that yesterday. So some of that's kind of behind that way, but.
Well, some people just don't even, or just they scan through the letter, they don't even pay attention.
Yeah.
They don't
Yeah.
write
Well, that
That happens a lot too.
that stuff's intimidating, you know, that I begin to try to read it, just.
Well, we've always told them that if you need us to read whatever the letters, because sometimes they'll call and say, well, this letter, blah, 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 you know, and you go, I need to see it. I mean, just don't throw it away.
That was the worst thing during COVID is them trying to read the letter to you.
So many people, Social Security is over, they just can't decipher Social Security notices.
Well, and so,
Huh? What?
Yeah.
Oh, yeah. That would
It's
be
like
that
a
too.
written in code, only they understand what they're saying.
Yeah.
I don't know why
Well-
Social Security sent out one in December, and then they turn around and have to send one in January that shows what their Medicare D is gonna be, you know, it's gonna be that different, I mean, that's just.
they're always behind, we had that the other day. And this lady was saying, well, I don't know, this is what they said they're gonna deduct, and this other letter says this is what they're gonna deduct.
I didn't know
I
it
was saying
changed
that here's behind,
No, because
Because a lot
I
of
get
times you
people
get-
that are all.
you'll get
Okay.
the adjustment before they
Right.
even get the letter.
Yeah, she has to receive that.
Trying to read between the lines, or figure out how they think, you know, what's going on. So, well, we'll go on and I'll get lunch ready, we'll break for lunch. And send me any emails, any questions you have, let me know anything I can do to help better. And, and send me any ideas for volunteers, or even just ask them yourself. So we can- And also any trainings, I wanna get just some more trainings set up for just the area. We need to get out there and do just the basic Medicare trainings and Medicare Advantage info. And so any thoughts you have that way, just wanna get across our area and have trainings, because we have a lot of people always asking, you know, they're gonna be signing up and they need to know the whole picture, so.
Does anybody else want any of your supplement books? I'm gonna go back and get a few.
They're in that.
I'm not, yeah, okay.
You got it.
All right, y'all got
Set
it.
it up. For lunch.
I print page 11 and page 1 to 35. List of the companies. Something like that. I occasionally print the GI right for leaving job coverage. And look at it, it's like page 13 and 14.
And David made it everybody go. But I never went. I'm sure. Yes, it is.
No.
Mhm.
And did this see, rain, is it? That's ready to go? Yes. Yeah.
Oh, I got coleslaw, I got fish too, Melanie.
Our vegetables, this is cornbread, without toppings. Help yourself to whatever, there's tea in this canister here, ice is here, and then there's water. And if you want coffee, it's just like that, so.